Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Jay here with us today, and Jay's flown all the way to Houston from Long Beach, California to see us. And he's got some issues going on with his neck, his upper back, his mid-thoracics, and his lumbar spine and pelvis. But that's creating sometimes some acid reflux for him that's bothering him a couple times a month when he eats the wrong things. So we're going to check him out. He just wants to be a healthy person at his age, and I think we can accomplish that for him. Let's have you face the mirror and check your posture first here, Jay. I'm going to have you close your eyes and flex your head forward and backwards for me. Now, we've already done Jay's orthopedic neurological exam. I didn't want to put you through all that today or have Renee have to hold the camera that long. So what we're noticing right now is that Jay's got some translation and also some rotation in his cervical spine. His head's deviated off to the right, which is making his left shoulder a little higher here, and that's where he gets a lot of the tightness right down there in that left trap too. And his pelvis has shifted to the left of center on the x-axis as well. He's got a little bit of a hyperlordosis or sway back, as you can see. His pelvis kind of jutted out forward, and his right foot's flaring outward, which we're going to take care of here. So, Jay, let's have you come over here on your tummy first, and I'll start on this table. Now, this is Jay's first adjustment here at Advanced Chiropractic Relief in Houston. His legs are even, which is a great way to start. But as I lift his legs up, you notice how the right one actually gets shorter. That tells me that his SI joint, or his sacroiliac joint on the right, is out right there. So we're going to be adjusting that in L5, right where it attaches to the sacrum. That's the lumbosacral joint. He's got tight paraspinal muscles in his thoracolumbar spine right here especially. He's got a little bit of a curvature through here. And he's got some mid-thoracic vertebrae placed right in here that are misaligned with the ribs, and that usually is the underlying cause of acid reflux or hiatal hernia. So we're going to be adjusting for that too. So I'm going to adjust his right SI first. There you go. You just take normal breaths for me, Jay. It's good. There we go. There. I'm going to adjust his sacrum straight superior to inferior on this right side as well. And then the sacrum on the left side, superior to inferior. Now we're going to adjust his left SI joint and his hip joint more in a rotation, internal rotation here. There we go. Now I'm going to adjust that right SI joint again. And then I'm going to move up to L5. Right there, straight posterior to anterior in the Z-axis. There's L4. Notice the angle of my arms change as I move up the spine. There's L3. L2. Now I'm just going to do some lateral oblique stretching on him. Jay's been under chiropractic care for how many years now, Jay?
30.
30 years. And he's been watching us on YouTube for a couple years and thought he'd come here to Houston and try out some Texas chiropractic.
No, Palmer.
Palmer, actually. Yeah, that's a better way to put it. Yeah. Palmer Chiropractic in Texas, which is a rarity, actually. There's Palmer graduates all over the world. When people call here from other states or cities around the country or other countries even and want to know how to find a chiropractor just like me, I've really developed my own technique through the years, so there's really not anybody just like me, but the closest ones are Palmer graduates who practice BioPhysics. Yep, still just a little short on that one. Does that still tighten up a little bit there, Jay?
A little bit on the right.
Yep, that's where it's at. Okay, so I'm going to get in there gluteus medius here a little bit. And yes, that's that right foot was flaring out too. That little tender right there.
Mm-hmm.
I'm going down more in his piriformis, which is right from his hip here over to his sacrum. That's a little tight right there too. L5 right here on the right. Right now I'm on his paraspinal muscles, just putting some deep, steady pressure in here. This is one of these hurt so good treatments. It kind of hurts a little bit while I'm doing it because of deep, steady pressure, but it feels better after I'm done. Now, Jay's got a little bit increased kyphosis in this mid-thoracic spine, so we got his head forward just a little bit so I can open these joints up. And we're going to start adjusting his thoracic spine. Yeah, just nice easy ones. You don't take some deep ones, or sometimes the deeper ones you take will tighten you up a little bit more, so just normal ones. There we go. Yep. Excellent. Okay. I think I got one more right here at T12L1. This is a tough area right here. Okay, so let's check his right leg length again. Well, that definitely helped. It's still off a little bit, though. Is that tender right here?
Yep.
Okay. Okay. He's got IT band tightness here, which a lot of times is really the tensor fasciolata. So, you've probably seen me use a turbinator before.
Bring it on.
Alright. It's a nice deep breath on this one. For the first time ever doing that, Jay did really good with that.
He did.
He didn't jump off the table like most people do on the first one. Okay. Now that helped a little bit there. Is that a little less tight than the last time?
Yes.
So I'm going to adjust his feet while we're in this position. There we go. Good. That arch in there. Jay stays active, which is one of the most important things anyone can do for their health is staying active. Movement is the key to life and rehab. He's been having a lot of torsional stress here in his lower cervical, upper thoracic, so I'm going to adjust his lower cervical and upper thoracic with this thumb move. Okay, just let your head relax. You're right in my hand, Jay. There you go. Good. I know you felt that right up there at that occiput. He's got some tight muscles here in his trapezius muscles and his levator scapula muscles, especially on this left side. Right there. And again, I'm going to get some deep elbow right in there. And that's real tender right there. That's the rhomboids. go ahead and turn you on your back for a second, yeah? Okay. Put your hands on your tummy there. Jay bought his x-rays from California, so I've already looked at those. And he does have some, just let it go right in my hand. Degenerative disc disease in his cervical spine, thoracic spine, and lumbar spine. That's just wear and tear from years of being in athletics and cumulative trauma, compressive trauma. So I am going to decompress him today for the first time. There we go. You should have felt that in your knee and your back. Did you?
Yes.
Okay, good. Let's sit you up here and face towards Renee this way. Alright, let's just check your shoulders here. Okay. Excellent. Yeah, you got a little more crepitus or grinding in this left shoulder. A little skip jumps through there too. There we go, good. Just his elbow and radius and ulna. Wrist carpals down here where they attach the radius and ulna, and then the digits. Okay, good. Good. There we go. Okay, let's come over here and lay on this table now on your back. I'm going to have you put your pelvis there and legs down this way, please. This is Jay's first spinal decompression manually, I think, isn't it, Jay?
Yes, sir.
And before we get a bunch of comments or emails about who else does this in the U.S., there's only 2 other people in the country that do this besides myself that I'm aware of. One of them's in St. Pete, Florida, Russell Jansen, and the other one up in Auburn, California, Dr. Dan Murphy. Okay, nice deep breath. There you go. Put it all the way out. There you go. Oh yeah, shit. One more. There it is. You feel that all the way down?
Yes, sir.
Okay, good. Get these out of here. Yeah, he's still kicking. So while his feet and legs are in this position, I'm going to adjust his toes,
Please do.
which are a little tight. There we go. Well, that's a good one.
Tell me about the adhesions and more.
Yeah, well, the adhesions that form in and around any joint in the body from compressive traumas or cumulative traumas can start locking those joints up and making them stiff and sore. That's where people start feeling the weather changes, as you probably heard with patients who have arthritis. And that's usually osteoarthritis, which is degenerative joint disease. Same thing, synonymous terms. So we still got these TFLs over here that are pretty tight. Yeah.
Are those a stretch or?
Yeah, this is mainly here just transverse friction across the fibers. They run longitudinally up and down your leg with the femur, so I'm going across the fibers to break up that adhesions in there. That turbinator breaks up most adhesions though. Okay. Yeah. Just to make sure I got everything balanced here, I'm going to check one other thing. Yeah, legs are even here. Stay that way. Good. Okay, now let me have your hands all the way up over your head this way, Jay. Stretch your fingers straight out. Yep, straight out. There you go. Yep, and you're even there too. That's good. Okay, let's stand you up over here and face the mirror for me, please. So I'm going to adjust his atlas and occiput here on the x-axis and the z-axis. Okay, so I'm going to have you flex your head forward and backwards for me again, Jay. And remember how this feels. and then back to neutral. Okay, when you take a look in the mirror, you can see that your head's up further and back more now. Your shoulders are a little more squared off than they were when you first started. Your pelvis still a little bit left. Take a look at that, Jay. But your head, see how your head's still a little bit right? Still a little off to the right here. So let's pull these up and back. Flare these hands way back like this, so you feel like tighten up your whole trap. This is going to be the most significant thing for you. Go straight back, straight left, and then tilt left. Okay, now shift your pelvis straight right, which is an exact mirror image of his current biomechanics. So we're going to adjust his atlas right here on the x-axis, which will send neurological messages into the hindbrain or the cerebellum that will create a new proprioceptive. Okay, there you can relax it. Now flex your head forward and backwards again. Alrighty, that's better. Oh yeah. And back to neutral. Ooh, take a look now. Yep, that's amazing change right there. Look at this. Much better too.
Centered is weird.
Yeah, everything's centered now. It probably feels different standing up right now, huh? But see how that squared his shoulders off and his head's up and back now, and it's actually straight now. It's not off to the right as much. And I think that's coming from his sleeping. You're taller right now, about half an inch. That's good. Jay, would you mind sharing with our YouTube subscribers what brought you here, and is this so far has this been worth your trip?
After a long time of dealing with many different chiropractors, I found the Dr. Johnson on the internet, and I felt that through what I saw and what the thoroughness, that this is something I needed to make extra efforts for to come and help myself help me.
Yeah.
So overall,
So you're interested in better health
definitely
and enhancing your health
We
as
all
you
should
get
be.
older.
We
That's
all
right.
should be.
We all should be. That's right.
You know, I'm 55 next month. You got to do stuff for yourself.
Yep. And we're gonna help to create that better posture for him so that he can stand up in a better three-dimensional biomechanical weight-bearing posture so his spine doesn't wear and tear over time. This is your Houston chiropractor, Dr. Gregory Johnson and Jay, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.